The dangers of baking soda, everyone should know. Baking soda is magic. Its uses are almost endless. Whether obtained as a result of mining, or made industrially, both are edible and can be used from the house to garden. It is used for almost everything. Its uses for health and hygiene are also countless: deodorant, skin care, digestive problems. But do you know the dangers of baking soda? Yes, like any effective product, baking soda can also have undesirable effects if used incorrectly. Watch out for these 5 dangers of baking soda before you use it. Number 1. Do not exceed the recommended dose. Baking soda is not dangerous if you do not exceed the recommended dose. Ingesting too much baking soda is dangerous for your health. But do not panic. Very high doses have to be taken for negative health consequences. It is only from 200 to 300 grams of bicarbonate that it begins to be dangerous for health. You know, you have the margin unless you want to down a whole package. Number 2. Do not take it every day even at normal doses. It's best to avoid taking baking soda for too long because of its high sodium content. It is therefore best to avoid taking baking soda after every meal for months, if you want to digest better. In the same way, do not brush your teeth every day with baking soda, even to whiten them. You must know how to be reasonable and avoid excesses. Why? Because of its sodium concentration, excessive use can lead to sodium overload in your body. The consequences can be vomiting, diarrhea, headaches, nausea, swelling of the legs, or in the most severe cases seizures or kidney failure. Number 3. It should not be prescribed to pregnant women for internal use. It must be avoided to be administered to pregnant women and children under 6 years of age. For this reason, keep baking soda out of the reach of children. Always seek the advice of a doctor before using any bicarbonate remedy on a pregnant woman or child. Similarly, bicarbonate should not be used in people on a salt-free diet or with high blood pressure. It should be avoided in case of high blood pressure or a stomach ulcer. The same for people with heart or kidney failure, pulmonary edema, kidney disease, liver disease, respiratory acidosis, or metabolic alkalosis. Number 4. Do not use it in case you are undergoing a medical treatment. Of course, if you use baking soda in a cooking preparation, no problem. But if you want to take it to calm heartburn, for example, it is better to be careful. There are indeed risks of interaction between bicarbonate and the medications you are taking. It is therefore important to always seek the advice of a doctor or pharmacist before ingesting a bicarbonate-based remedy if you are under medical treatment. Number 5. Watch out for side effects in some people. Although very rare, side effects may occur in some people. Side effects can be swelling of the feet, hands or ankles, weight gain, dizziness, muscle pain, and the risk of allergy, also very rare, but not zero. This can also lead to itching, pimples, hives, difficulty breathing, swelling of the lips, tongue or face. This is why it is recommended that you seek advice from a doctor or pharmacist before taking bicarbonate for the first time. If you want to use it on the skin, do a test on a small area first to make sure you don't have any allergies. Thank you. Please consider subscribing if you like the content.